Hi, I'm Dr. Vicki and I'm a medical aesthetics physician at Nu.Reflections. I am a Singaporean doctor, but I was medically trained in Australia and also obtained my dermatology qualifications from the United Kingdom. Having lived overseas for a large part of my life has influenced me tremendously, and this includes how I practice medicine as well as how I see beauty itself. The Australians are very much into the naturally healthy glowing skin with minimal makeup, so it gives me great pleasure to help my patients achieve confidence in their skin whereby they can bear their skin with minimal makeup. For me, there are three main things that are important about good skincare. One is a good cleansing regime. For me, it's very important that every night before you go to bed that you cleanse your face thoroughly from the day's pollutants, dirt, bacteria, sebum, built up, makeup, etc. Number two, sun protection. I'm sure all of you would know a lot about that already. Never go out, whether you are indoors or outdoor, without putting on sunblock first every day. So there are three main things that causes acne and pimples. Firstly, there's excessive oil production that's worsened by hormonal changes, which explains why during puberty, premenstrually, or also sufferers of polycystic ovarian syndrome tend to get more acne than others. Secondly is clog pores. It can be a natural process, but of course wearing thick makeup, not cleaning up makeup properly can worsen that process. Lastly, and most importantly, is having a particular bacteria that we call P. acne living on our skin that sort of feeds on the sebum, the oil, and sets up the inflammatory process that causes the papules and the pustules, the larger acne that we get. I think it's first important to distinguish between post-inflammatory hyperpigmentation and actual acne scarring. Very often after a pimple subsides, we are left with these little brown marks on our skin. That is actually texturally the same as our normal skin, and it's because of a skin injury that stimulates our cells to make more pigments. So the pigments dump that on our skin. To hasten the recovery of these marks, there are two ways. One is through exfoliation, so you can use an AHA product at home or physical exfoliator to hasten the skin renewal. Secondly, a simple laser can be used to break down the pigments to help the body to sort of mop up these pigments quicker. When you have actual acne scarring, so those are the depressed scars that you see that's texturally different from normal skin. So that is actual acne scarring. So depressed acne scars usually only forms when we have the large papules or the pustules as acne. Because when we have this pocket of pus and a lot of inflammation going on, the skin will heal by a process called fibrosis, which is forming new tissue that is not quite like our normal skin, but a much tighter fibrous substance that is very tough and hard. So what happens is you get these appearances of acne scars. You can imagine the thick band that is pulling down the tent of our skin, causing the depression. So you can have different shapes of scars: rolling scars, eye peak scars, box scars, and some people with an exaggerated healing response, you get one of those bumped up hypertrophic scars as well. So now there's a new treatment as well called the EnerJet Acne Scar Repair. What it does, instead of going top down to stimulate skin renewal, what we do is go from bottom up. So you imagine this is your initial acne scars with a thick fibrous band that's pulling it down. What the EnerJet does is a needleless system that uses strong air pressure to eject little bullets of hyaluronic acid molecules into the skin. Once it pierces through the skin, it acts as like micro bullets to cause dermal injury, breaking up this initial big blob of fibrous tissue into smaller bands, hopefully. This attracts water molecules as well as stimulate collagen production to plump up the skin to improve the appearances of acne scars. The downtime that you can expect from the EnerJet Acne Scar treatment will be about a week. There's an initial couple of days of generalized redness and swelling that will subside after 3 to 5 days. Little scabs will form where the hyaluronic acid molecules enters the skin that will fall off within a week. Usually our patients are okay to go back to work within the week. The best candidates for the treatment would be people who have got depressed acne scars. Patients who've come to us with still active acne, we will help them in treating the acne first before we discuss about treating acne scarring per se. Hi, I'm Dr. Vicki Leong. Thank you so much for watching. Please come down to have a chat with us if you have troubles with acne or acne scarring. We're here to help. Thank you.